Greetings, New Zealand naturopath Eric Bakker, author of Candida Crusher. Thanks for checking out my video. I have a request from a YouTube subscriber to my Candida Crusher channel regarding hiatus hernia. Eric, can you please explain about hiatus hernia and also the natural treatment for it? What's the most effective way to remedy this problem? I've got it pretty bad. So hiatus hernia is actually not that uncommon. It tends to occur more in people sort of like my age, like 50 plus. Many people who have this problem, in fact, are not really sure what they've got. They think that they could have an over-acid stomach. They think that they've got heartburn or reflux, So let's have a look at what hiatus hernia is. Well, when we chew food and swallow it, it goes through the esophagus, from the mouth into the esophagus, into the stomach. But to do so, it has to pass through this sort of thick area of muscle called the diaphragm. So the diaphragm basically is a powerful part of the body that really helps the lungs to work properly. It helps the lungs to expand, and it's a very important part really of respiration and breathing. So the tube, the esophagus, is a hollow tube, and it goes through this big piece of thick muscle, the diaphragm. So all a hiatus hernia is basically the stomach being displaced and coming up into that esophageal region. So now what happens is you could have some stomach acid coming back up through the diaphragm in to the bottom part of the esophagus, giving like reflux or reflux disease or GERD or heartburn. It can be really uncomfortable for some people. So, but there are other causes also naturally. They call hiatus hernia the great mimic condition, the great mimicker. So people who've got it may think, as I mentioned, that they've got something wrong with their stomach. Some people may think they're getting a heart attack. In fact, they get like, oh my God, I've got pain in the chest. Quick, call the doctor, I'm dying of a heart attack. So why does it occur? How does it occur? Well, it tends to occur more in women than men. It tends to occur in more older people. I've seen it more also in more unfit people, larger people, people that are carrying quite a bit of weight. People who tend to keep in good physical shape, eat the right kind of food, and don't stress so much, have a much less a problem with hiatus hernia. Some people also believe that it can be from repressed emotions, being peeved off or angry, or I can't stomach this anymore. Things like that. So I certainly believe that there will be some kind of emotional component to some people's presentations of it. Under acid stomach is very common. In fact, I'm going to do some videos on hypochlorhydria, where a person has not enough production of digestive enzymes or hydrochloric acid, and that can mimic itself like an overproduction and give heartburn. So there are certain ways we can fix hiatus hernia up and keep it under control. One thing I'd like you to consider, certainly if you've got it and you've been diagnosed with it, is buteyko breathing, is to learn how to breathe properly, how to activate the vagus nerve properly, how to really use the diaphragm properly. By seeing an expert buteyko practitioner, and you can find them in America by going to the Buteyko, Buteyko. So go to the Buteyko website and look for a registered professional. We've got them in New Zealand, Australia, we've got them in Europe, we've got them in the USA. These people are going to help you immensely if you've got hiatus hernia. A couple of years ago, I started searching online for a technique that would really help my patients. And I found an interesting YouTube video by a doctor, Dr. Williams, I think his name was, David Williams, I think it's Dr. Williams, but there are many other videos you can similarly see, and I'm going to demonstrate that technique right now. It's quite a simple technique. So what we're going to try and do is we're going to try and relax the diaphragm, and we're going to try and make the hole a little bit bigger, which I'm going to show you in a minute, and then we're going to try and force that diaphragm down a little bit, and then tighten that area up again. And if you do this exercise every single day, and you continue it on, for quite a few weeks and months, and also learn how to breathe properly through buteyko, and understand the connection with eating the right kind of food, and learn to back off the stress, you should be able to reverse this thing naturally and get it under check. You should not have to remain on acid blocking medication for the rest of your life like your doctor leads you to believe. It's a pretty dumb thing to keep taking medication to block stomach acid, when a simple technique like I'll show you can give you enormous relief from this condition. So I want you to stand up, and the first thing we're going to do, which I'm not going to do but I'll show you, is you get a glass, in this case it's a cup, and you're going to put probably about half to 3/4 in the glass of warm water. So you don't have to have the water too hot, but reasonably warm water, and you're going to drink that water. And then you're going to relax for a minute and just breathe in and out, and try and do a little bit of belly breathing for a minute. Then you can lift the hands up. And then what we're doing here is we're actually we're bringing the diaphragm up a little bit, and we're opening the hole there, okay, by doing this. And then what we're going to do now, when we've done that, we've got our hands in this position, and we've got that water in our stomach, so it's relaxed our stomachs, put a bit of weight in there. Is you can just do a bit of gentle dropping on the ground like I'm doing now. And now, some breathing again. What we're trying to do now is activate the diaphragm and close that hole off a little bit. So what I've just shown you there is a very simple technique to relax the diaphragm, expand it, put a bit of weight in the tummy, and then with gravity pull that tummy down and just hopefully to close that diaphragm off properly. With proper breathing control, when you learn how to master breathing properly, nasal breathing, belly breathing, never mouth breathing, which is the essence of Buteyko, and slowing your rate of breath right down, you're going to master the ability to control hiatus hernia naturally. And I can almost certainly guarantee within 6 months of doing this, you're going to rarely be bothered by GERD again. So give it a go. Don't forget to subscribe to this channel for lots of tips like that. And the other one is click on the link below in the description box and you can get a free report off me, free Candida report. Thanks for tuning in.